Hi everybody, I'm Dr. Jui Kim, a family medicine specialist at the Aging Center. When we think of obesity, most people picture someone overweight or with a large body frame. But surprisingly, when we check body composition, results like in-body, some people who appear slim are actually classified as obese. Today's topic is exactly that, skinny obesity. So what's the difference between general obesity and skinny obesity? General obesity refers to people with high body weight or a high BMI. This is usually due to excess subcutaneous fat or visceral fat, and the body shape visibly changes, or the body shape may not change. In contrast, skinny obesity refers to an individual whose body weight is normal or even underweight, yet they have a high body fat percentage. If your BMI is in the normal range, but your body fat exceeds 20% for men or 30% for women, this is defined as skinny obesity. Though they may look slim on the outside, these individuals often have high visceral fat and low muscle mass, commonly seen in spider-like or abdominal dominant body types. The arms and legs appear thin, but the belly noticeably protrudes. If your weight is normal, but your waist circumference keeps increasing, you might want to suspect skinny obesity. Skinny obesity is usually visceral fat obesity. Common lifestyle habits can lead to these conditions, such as long periods of sitting, little to no exercise, irregular meals, frequent consumption of instant or delivery food. In fact, many office workers unknowingly lead lifestyles that cause skinny obesity. These habits reduce muscle mass and increase fat accumulation. If you frequently consume refined carbs or greasy food, fat builds up even faster around the organs. So why is skinny obesity risky? The biggest issue is that it's not visible. Since your weight hasn't increased and you don't appear overweight, most people leave it unchecked, only realizing after a concerning health checkup result. Visceral fat is actually more dangerous than subcutaneous fat because it's close to the cardiovascular system. It's closely linked to metabolic conditions such as high cholesterol, high blood pressure, diabetes, or other, etc. Also, people with low muscle mass relative to fat may suffer from muscle loss and insulin resistance. So skinny obesity requires a different approach than regular weight loss plan. Simply cutting meals or fasting won't solve the issue. Instead, the key is to eat properly and build muscle. A balanced diet rich in protein, fiber, and minerals is essential to restore metabolic function. Strength-focused exercises help rebuild muscle mass, and rather than focusing on weight, you should track changes in body fat percentage and muscle mass. For those who are already underweight, extreme calorie restriction can actually be harmful to health. So skinny obesity often doesn't respond well to typical weight loss strategies, and in some cases, poor management can worsen your health. In my practice, I offer a completely different personalized treatment plan compared to general obesity. By analyzing body composition, we accurately assess muscle mass and visceral fat levels. We then provide a customized diet and exercise plan focused on metabolic health rather than just body weight, along with a sustainable, expert-guided system for long-term care. With a personalized plan, I recommend improving skinny obesity safely and effectively. So obesity isn't just about appearance, it must be managed for your health. If you're slim but your in-body results show a high body fat percentage, we recommend visiting the clinic for a precise diagnosis and working with a specialist to improve your condition. This has been Dr. Jui Kim of the De-Aging Center. Thank you very much.